we can anticipate your questions, and I think most of them will be answered. So there's a lot of misinformation and shallow information out there, so that we need to dig a little deeper into the facts before we move forward. So we're going to do that in the next 23 minutes. Panelists this morning: Kyle Bauer is Chief Executive Officer at Cuyuna Regional Medical Center in Crosby for the last 4 years. Tim Rice, President CEO of Lakewood Health System in Staples, is on the call. Tim Houle, County Administrator of Crow Wing County, and Dr. Peter Henry is the Essentia Health System-wide Chief Medical Officer since 2016. So, well, clearly we have the right people to ask our questions. And we'll just get started here. Question number one is, we are all feeling COVID fatigue. Why is it important to continue to practice social distancing, mask wearing, and good hygiene? And this is particularly true now when folks are getting the vaccination. Marcia and I have had our 2 shots. A week ago was our second. So, okay, a week from now is our 2 weeks after that. So can we stop wearing masks, or what's changed now that we've had the vaccine and maybe others haven't? So a lot of new rules, some social things going on there. And those are the questions everybody's asking these days. On the top of my list, it says Dr. Peter Henry. So that's about as random as we can be. Let's start with Dr. Henry, if you would answer that question, please.
Thank you, Dan, and thank you everyone for the opportunity to talk to you today. I think the key thing that I would like to answer this question is that we know the vaccines are excellent. They are very effective, and historically, when you look at percentage of people and the amount of protection people get, they are as good or better than many other prior vaccines that people have accepted willingly. I also think it's very important to recognize that even though we're making significant progress in the 65 plus group in Minnesota, nationwide and in Minnesota, we've only vaccinated about 15% of our population. And so there's still a large number of individuals that are potentially susceptible to this infection that we need to have protection. The vaccines, although very effective, are not 100% effective, as is no vaccine. And so we still don't know how many people can get a mild degree of the COVID virus and still be able to transmit it. And that's why it's really important for us to continue to wear masks, social distancing, and so forth. It's interesting, for 35 years, I've been telling people, cover your cough. If you're sick, stay home and wash your hands. That's really no different. The difference is that this particular infection, as compared to even influenza viruses that circulate through the winter months, has the propensity to have and cause death 50 to 100 times greater than even influenza. And so I think we're getting there, but I know people are tired of wearing masks and social distancing, but we have a long ways to go to get our population vaccinated to the point where we can hopefully eradicate the virus and protect all citizens. So it's important to note also that just last week, there were still 2,000 deaths attributed to COVID-19 infection in the United States, and that the levels that are circulating right now in the United States are similar to what we saw last summer. And then it only took about 4 months for us to get to our peak in November. So we still have a ways to go. Thank you.
Thank you, Dr. Henry. Next on my list, Tim Rice from Lakewood Health Systems.
Pretty much supporting what he said. So maybe I'm really glad you started out with a medical provider to help, answer that question. So maybe even Dr. Henry, just to help me with it. But I think another important factor is the variance. So is that coming into play here?
Indeed. We don't know. It's interesting. People think the variants come from outside of the United States into the United States. But what the virus naturally does is it mutates in order to continue to be able to infect its hosts. And we know that variants can start here in the United States, for example, the California variant. And so the more people we vaccinate, the less transmission we have. Every time that virus is transmitted, it has an opportunity to mutate or to become a variant. And so that's another key reason. And thanks for bringing that up, Tim.
Tim, anything to add?
Nope.
Very good. I move then on to Kyle Bauer on my list. I don't see Kyle here. Maybe you're on the next screen.
Yeah, I don't think I have much more to add from what Dr. Henry said. I think these vaccines are incredible. I mean, it truly is a scientific minor miracle that we have it this quickly, less than a year from when the virus really hit here. But I still think the information out there, you might have very good protection against severe illness from COVID after the vaccine. In fact, that's almost 100% that you won't be hospitalized or die from it, but you still could get a mild case of it and therefore be able to spread it to others. And as Dr. Henry said, with only 15% of the population being vaccinated and whatever percentage who maybe already had COVID in the past, that still leaves a lot of people that could be susceptible to this disease. And so that's why it's important to continue to follow the masking and social distancing. But the light is at the end of the tunnel, but it's going to take a little bit longer.
Thank you, Kyle. Tim Houle, please.
Well, thanks for giving us the opportunity to talk about this today. It's really important in our community. I think from my perspective, I know I have COVID fatigue, and my guess is that almost everybody listening to this has COVID fatigue as well. The problem is that while I'm tired of COVID, COVID's not tired of me. And so this idea of vaccinations and the rates at which we're transmitting in the community is really important. And it is until, because of that transmittability, even if you've been vaccinated, we need enough of the population to be vaccinated to protect all of us against that serious illness, serious hospitalization, or the risk of death. Well, we know about these vaccines, and it's been said, but these are very, very effective vaccines. I even hear some discussions about, well, should I be trying to get the Pfizer vaccine because it's got this higher percent effectiveness? That percent effectiveness is really just in the clinical trial, in the placebo group, how many got COVID at all, and in the vaccinated group, how many got COVID at all. And so those percent effectiveness is really about whether or not the degree to which it protects against mild to moderate. All of these vaccines do an excellent job of essentially eliminating the risk of hospitalization and death. That is a miracle unto itself. And so these things are really, really effective. And we need enough people in the population to take the vaccine so that the transmittability, even for a mild case, you're not transmitting it to someone who's unvaccinated. And if there is a substantial portion of the population that remains unvaccinated, we will continue to experience disruptions in our community. That's what we're trying to get away from, is the disruptions and the lethality of COVID.
Very good. Thank you. Yeah, it's such an interesting virus. Back before the snow came, I had an allergy thing going on, and Marcia said, you should go be tested. Well, I went and tested, found out I'd had the COVID, and it was just a mild allergy, kind of annoying for a little while. No big deal at all. And Marcia and I have been really careful, and yet I got it. And then we've been together 24/7 for months. She hasn't had it and it doesn't have it. So, wow, what's that? So it doesn't seem to follow a lot of what we expect it to follow. So that's interesting. And then I heard this morning, oh, they're giving the shots to the gorillas at the San Diego Zoo. Well, how are they ahead of, my grandma? Well, you dig just a little deeper, which is why we're doing this forum, and you find out, no, it's a different vaccine made for the gorillas. Okay, well, once you know that, you don't worry about grandma. It's, they're rolling it out as best and as fast they can. It's a monumental task. So question 2 is to tell us how the vaccines are being rolled out in your organizations. And we'll go back to Dr. Henry, who's first on my list here.
So our health system is getting its vaccine from the Minnesota Department of Health through what's called the Care Delivery System Consortium. We are currently getting all 3 different vaccines, Pfizer, Moderna, and the Janssen or the J&J vaccine. And from there, we distribute it and it goes to our various hubs. We have a system that expands all the way across northern and central Minnesota. We get separate allocations that come from the states of Wisconsin and North Dakota where we practice. And so we're getting it through that healthcare system. We work with that consortium of 9 other hospitals, and in order to try to most equitably give it to the counties that need it the most, where the populations have the highest rate of being unvaccinated for those currently, those individuals over the age of 65 plus.
Thank you, Dr. Henry. Yeah, we got in through Essentia, but we also signed up with the state through their system. And they keep sending me emails saying, okay, you're in line, and I've tried to unsubscribe from that. I don't want to take anybody's place in line if I don't need it, but so that's a little confusing, but Essentia was great getting us in.
That has been a problem. I think all healthcare systems have experience in that people do get, even though we have our patients and we can track whom has received a vaccination through us, and then we can also look at the vaccine database in the state. That's not always current, but that is difficult to know when someone has been vaccinated. We can remove them from the list of individuals that they think we think still need the vaccine. So,
Tim Rice, how are vaccines being rolled out at Lakewood Health?
Again, we're all getting them from, in that same manner. For ourselves, because we're never really sure what level of vaccine or how much we're going to be getting. We just been having people call in to Lakewood and get on a list. We've been following the guidelines about who we're vaccinating. We did have a waiting list of about 1,000, but now this week that waiting list is down to 299. We do have 132 on that list of over 65 that are unable to receive the vaccine, either because they've been ill or getting different therapies or scheduling conflicts. But basically what we're doing, we actually bought a couple of fish houses, ice fish houses, and we have them out on our parking lot. And that way too, once we have everything all ready, when we have the vaccines, we make the call, set up an appointment. They just drive up. They don't have to get out of their car. They can just get the vaccine right in the parking lot, and they can be on their way after they wait 15 minutes. But that's primarily what we've been doing.
Interesting. You could put those fish houses out on a lake and catch a little fish along the way too. Get more Minnesotans.
Yeah.
So
we could be a little more creative, but right now they're in the parking lot.
Oh, that's fine. And Mr. Bauer, how about at Cuyuna Regional Medical Center?
Similar to Tim and Dr. Henry, we receive our allocations from the state through what are called regional coalitions. And so, again, as Tim mentioned, we're not necessarily sure how much we're going to get each week. And so once we know what our allocations are, then we open up a phone line to get people scheduled. As Tim mentioned, we also bought a fish house that we originally were using for mobile testing, and now we've converted that into our mobile vaccine platform. And we can do up to 1,000 people a day. We've not gotten allocation of that amount yet, but that's kind of what we're estimating. To date, we've vaccinated between our own employees. We were able to do the Crosby schools and the Pequot Lake schools and Cross Lake Charter School, and then the 65 and plus population. We've administered about 3,000 vaccines to individuals, and we have a drive-up clinic going today, about 300 people.
Interesting. I wouldn't have thought of the fish house idea, but terrific. And Tim Houle.
Yeah, that's definitely a Minnesota solution there.
I love it. Perfect. I'm surprised that hasn't made the national news yet. Tim Houle, talk about the county. Now, you're obviously not a hospital, but how does that work with the county for rolling?
Well, we are a local public health agency, Dan, And so we are also holding vaccination clinics, and the state of Minnesota tells us basically who to target when we get our vaccine dosages. I think there's cause for, we're in a better shape than we were even a month ago versus 2 months ago. I checked this morning, the vaccination rate in Crow Wing County is 18.4%. We are over 50% of the age 65 population. And it's important to note of that 100% of that isn't really the goal. We know that anybody under 16 is not eligible to receive the vaccine. That's about 15% of the population in Crow Wing County. So unless that expands, you can't achieve 100%. So we're making good progress on the vaccine. Healthcare workers have largely been given an opportunity. Teachers we're well down the path with getting teachers vaccinated, nursing home residents and staff, assisted living residents and staff, first responders, and the over 65 population. We are making good progress. And this is a window of opportunity because, as Dr. Henry said, yes, the case rates are as low now as they have been since last September. That's the time we want to get the vaccination into people's arms as quickly as we can. So we are also holding vaccination clinics based on the state's guidance as to who we can and should vaccinate. And I think there's cause to believe that the vaccine supply will continue to increase. I think it has been increasing. And I think we will start to see that hopefully even more so. Our partners here, I just want to give a shout out. It is an honor and a privilege for us to be associated with such great partners in the regional healthcare systems that we're working with. And I want folks to know that those efforts are pretty closely coordinated locally. So we know what each other's doing. We have calls between and among the staff. There have been calls of, do you need vaccine? Because we have some. And so I just think the partnership and folks locally ought to know this system is working very closely together.
Very good. Thank you, Tim. On the news this morning was the story about a rural hospital in Kentucky. I think there's a 20-bed hospital. They've had almost no vaccine. And now it said, well, they got 200 vials that showed up the other day. Is that 200 patients, or do you get more than one vaccination out of a vial? I'm not sure how that works. Maybe Dr. Henry, let's go back to you. Do you get 10 shots out of a vial, or 5 or 1, or how many?
It can vary on the vaccine manufacturer, but in essence, for example, the Pfizer vaccine, initially they thought you could get 5 doses out of each vial. We now know that we can get 6 if we use the appropriate needle and what's called a small volume needle for that. And there's most of the time the kits come with them to do that. So it varies by the manufacturer as to how many doses you get out of each vial. But
okay, very good. Question 3, if we're a patient or a client in your organization, what's the best way to stay informed? I'm sure website, but there's so much information out there. Not everybody is web savvy and so forth. So we'll go back to Dr. Henry at Essentia Health. How do we communicate with people, or make sure you are being communicated with?
Well, I as you said, the website, but not everybody has access to Wi-Fi or necessarily a computer. But all of our healthcare systems in our local area here utilize the electronic health record called Epic. And there's an application there that you can use on your cell phone, or a family member who has a cell phone can sign you up for what's called My Chart. And that's really the best way to continue to get notifications. You can self-schedule through that application for a vaccine. You can also do the attestation as to your medical conditions, your age, your occupation, and so forth, that we will be utilizing as we move into phase 1B, into the second tier and the third tier, once the Minnesota Department of Health allows us to move in that direction. So I do believe that all of our health system websites are phenomenal resources. Obviously, the Minnesota Department of Health, the county has a great website as well. People have much access to those things, and there's phenomenal information there that is accurate and kind of helps dispel a lot of the misconceptions about things. But the My Chart application, before we had COVID, and we had this really strong necessity, we've advocated for that MyChart for many, many months. But right now, we're about 75% of our patients are on MyChart. Our goal would hopefully to be about 100%. We know most people have a cell phone, and that's a great way to communicate with your physician. And also, as we move past the pandemic, it's a great way to get your tests. We have open notes. You can get all your labs, all your office notes immediately once they're resulted. It's a phenomenal resource, and all of our healthcare systems have that access to that.
I just scheduled another appointment and they asked, should we send you a postcard? And I said, no, you people are relentless in reminding me of my upcoming appointment. So that's working very well. So that's good. Tim Rice, Lakewood Health System, how do we connect with you and vice versa?
Yeah, I don't think a lot to add. Like what Dr. Henry said, regard to, not everybody may have access to computer, other services. Well, then, just using your local media, your different media sources, I think are important if you don't have access to that. But you're right. We also have, our Facebook pages, but pretty much just the same things, but on how we try to connect to our patients and the community.
Very good. And Kyle Bauer at CRMC, I know you do some videos.
Yeah, don't have much to add. We're kind of doing it the same way, trying to reach out to our individuals. So on our website, through Facebook, we put ads in local media, and we have vaccination clinics available. The only exception we made, and this was just a one-time thing that we did, but we did target our patients 80 years and plus. And so we actually did reach out to them by phone. Just not saying that because you're 80, you can't get on a computer, and I'm not saying that at all, but that's maybe not quite as technologically savvy group. But that was just a one-time thing that we did because that was a tremendous amount of manpower to try to call patients. And if they weren't home, do you leave a message and have them call back? But we felt that we would do that one time for those upper age groups. But going forward, we will do electronic notifications when we do have vaccination clinics, and then there's a number to call in to get your appointment scheduled.
Very good. Thank you, Kyle. And Tim Houle at Crow Wing County.
We're a little bit of the odd man out because we don't have Epic as a healthcare system like most of the healthcare systems do, or at least we don't use it in the same way. We have had a couple of registries at the county, and it is for specific targeted groups. Most of the clinics we've been holding have been for targeted groups where we did not have like an open call. We went to the specific location. So for instance, with nursing homes, the state had a preferred pharmacy program, and those pharmacies worked directly with those nursing homes. There was no open call for that. It was more direct service provision. We do have a registry out there for those who are over 65 who are homebound. If they can't get in, we'd like you to register, and we'll figure out how we can get to you if necessary. But I think it's, for the most part, probably what folks have been experiencing is like you, Dan, as long as there was a short supply, there was going to be a run on how do I get the vaccine. We saw that with toilet paper, for crying out loud. So I think what we're experiencing is really just a function of the supply of vaccine. As that supply may change, so too might this. But I think all of us as providers have known people were registering in multiple locations, either with the state system or with MyChart, maybe with the county. And it was in an effort to try to get the vaccine, which we want to have happen too. So I can tell you, we regularly run into people that will call for a clinic and they will tell us, already got the vaccine. We're like, no problem. And we just move on to the next on the list. So we know that there is multiple registrations going on. And in the beginning, that's really not a big problem for us. We can work that out. Longer term, as vaccine supply gets to be more plentiful, I think that issue probably will go away.
Very good. Thank you, Tim. I see it as exactly 9 o'clock. Karen, our last question is, what are some of the things we can do to stay healthy? I think we know those things, but quickly, Dr. Henry, wear a mask, wash your hands, social distance. Beyond that, what do you emphasize for staying healthy?
I think every one of the health systems that's on this call, including our public health officials, would also say, get your regular health maintenance. Our
Right.
clinics are safe, our hospitals are safe. We've taken many, many precautions. We want people to go in and get those screening for breast cancer, colon cancer, high blood pressure, have their lipids checked and so forth. And I think that's one of the key messages that other way to stay healthy. There's some questions about whether or not masks will be necessary after everyone's vaccinated. I think that's still an unknown. The variants or the mutations of the virus are a great unknown at this point in time. But I'm very optimistic, actually. I think if we can get the vaccine out as quickly as early this summer, I think the risk of more variants becomes significantly less, and we can hopefully get back to a new normal. One thing I would add is that it has been phenomenally successful. If you look at, I haven't had a cold in a year, and I'm looking at, do I change my behavior going forth? I've been a typically very healthy person. I come in contact with sick people every day of my work when I was doing direct patient care on a daily basis. I've always been a believer of cover your cough, wash your hands, and that's important. And if we look at the influenza activity and other seasonal viruses such as RSV, they've been almost non-existent. And that should tell everyone that these things work not only for COVID, they work for all the other things that we can contract and become ill with. But I urge people, go back, get in to see your doctor, get your annual wellness examination done, get your health screening done. And I'm sure that Tim and the others would also, and Kyle would advocate for that as well for their health system.
Very good. Tim, Kyle, Mr. Houle, anything to add to that? Looks like
No, I think that's exactly right. And I think there are some disturbing numbers nationwide. When you look at those type of screening activities, breast cancer, colon cancer, they're tremendously down. It doesn't mean people don't have cancer. It just means that it's going undetected. And those cancers, if they're caught early, are very, very treatable. But any delay makes that much more difficult. And so would, again, just take on to what Dr. Henry said, please get your annual preventative services completed. And we're very, very safe to come to the hospital or clinic.
Well, thank you very much. We're just past time here, and I promised to end on time, so we'll do that. My gosh, I've got so many questions. We could go another hour for sure. So thank you, Dr. Henry, Tim Rice, and Kyle Bauer and Tim Houle for answering our questions today. This is going to be a great day for crowing Energized. So I turn it back to Karen, and I'm going to go sit in the living room and watch the rest.
Thank you.
Thanks,
Dan.
guys.
Thank you.